Hi everyone, Kylie Moss, just coming to you from the Centers for Vulvovaginal Disorders. I wanted to talk to you a little bit about things that I've been thinking about in the last couple of weeks. One is the fact that a lot of patients we see will see a number of clinicians and be told that they've been tested for bacteria, yeast, sexually transmitted infections, and evaluated with an exam. And because none of those things show what's going on with the patient, they'll be told that there are no other medications or things that the person seeing them can think to offer them. And I was meeting with the residents, that those are people training to be specialists in OBGYN, doctors who've already completed medical school and are learning more so that they can specialize in gynecology and obstetrics. And I was talking to them about vulvodynia, which are pain conditions of the vulva. And I was asked a good question by one of them, which is, this seems challenging to people who don't have a lot of experience treating this population, and what advice or quick tips can you give to make it easier? And what I told the person is that we really have to treat this part of the body like any other part of the body and think of it broadly and not just get tunnel vision about infections. There's a mnemonic that we learn in medical school. I'll read it for you and we can cut it into the clip, but it's called Vindicate. It's an acronym, and the V stands for vascular, meaning to do with blood vessels. The I stands for inflammation or infection. The N stands for neoplastic. That means like precancer or cancer, which we sometimes see in the vulva related to HPV, which is the virus that also causes abnormal pap tests, but can also cause vulvar cancer. We also see D, degeneration. We see people who have pain related to disc disease in their back that can affect their vulva. I is idiopathic or related to iatrogenic problems. So that would be like iatrogenic means something that medicine has caused. So you might be taking a medication that is causing side effects in the vulva or the vagina. And if we're not thinking about those things, then we won't ask you a good medical history and ask your medications to be able to evaluate if one of them is causing a problem for you. C is for congenital. Congenital means something that is usually present before birth or very early in life. Autoimmune, meaning the body is attacking itself. We see that with our patients with lichen sclerosis. T is traumatic. We can have patients have injury to their buttock, which is where the nerves that go to the vulva originate. E is for endocrine or environmental causes. Obviously, endocrine is really a big concern because that's related to hormone status and other illnesses that can affect the vulva. And then the environment. We have people who have irritant dermatitis and other concerns that can affect their comfort with sex, their vulva or their vagina. So I told the residents that it's, like I said, really important to remember that this is a part of the body like any other part of the body, and that it deserves a broad differential, and that if you approach it that way and continue to be curious, then you will come up with the answer for a patient and be able to help them a lot more than if you didn't. I can think of examples in our practice. We had a patient who had something called red vulva syndrome, which is where steroid overuse had caused dilation of very painful blood vessels. And if I hadn't been thinking about this broad differential, including vascular problems in the vulva, I might not have come up with the diagnosis, which requires really specialized medication to help a patient get better. We have patients who have congenital or genetic problems that affect their vulva that also need very specific kind of medications, which if you're not thinking broadly about this area, you won't recognize. There's something called inattention blindness, which is this phenomenon in which people, and especially clinicians who are considering medical circumstances, will miss things because they're not in their mind as possibilities. And there was a really good example of this. It was there's been a study of this in radiology. There's been a study of this in anesthesiology, but in both of those studies, doctors were shown pictures of chest x-rays or CT scans that had pictures of a gorilla in them. And to an untrained eye, it would be very obvious that there was a gorilla in this chest x-ray or CT scan. But to someone who has looked at CT scans and chest x-rays over and over and over and has a very specific way that they evaluate that imaging, they may be looking only at the landmarks that they usually evaluate and completely miss the fact that there is a gorilla. And in fact, in both of the studies, both in anesthesiology and radiology, most of the people who looked at these pictures did not see that there was a gorilla in them. And so it's about thinking about the forest and the trees and not just going about evaluation in a rote way. So I think inattention blindness affects a lot of gynecologic patients, and we really have to zoom out and think about all the possibilities that could be affecting someone's vulvovaginal health when we're diagnosing and treating vulvovaginal disorders. So those are my thoughts for the day and the week, and I hope you have a good day, and I will talk to you soon.